In this video, we're going to talk about the 7 categories of drugs and how they affect the natural body, both physically and psychologically. We're going to elaborate on the negative effects and what impact it has when a foreign substance enters the natural human anatomy. This is a topic we all should be aware of, especially now that these substances are very widespread in our societies. It's become very common for people of all ages, often falling under the influence of drugs without knowing about the internal changes. The purpose of this video is strictly to educate about the harmful nature of foreign substances. In the world of illicit and abused drug use, there are essentially 7 different types of drugs, which all have their own set of characteristics, effects, dangers, and side effects. And of course, not everyone was born with the same anatomy, therefore so many factors are involved, which can influence the response to the effects of drug use, which we will be discussing in this short video. Be sure to share this video with anyone you feel could benefit from this video's information. Let's start by definition. A drug is any substance that causes a change in an organism's physiology or psychology when consumed, legal or illicit. Once a foreign substance enters our bodies, and when administered to a living organism, it produces a biological effect. Whether it be a pharmacology drug, which is a chemical substance used to treat, cure, prevent, or diagnose a disease or to promote a well-being, usually often provided by a pharmaceutical. Or it could be a psychoactive drug, which is a chemical substance which affects the function of the central nervous system, altering perception, mood, or consciousness. But should any of these substances become a concern when the body begins to crave and start to develop a dependency, even if it's just caffeine or a prescribed medication? Drugs are typically distinguished from food and substances that provide nutritional support. Often people who have been associated with drugs over a long period of time begin to neglect these essentials of what the body really needs. When that happens, a nutritional deficiency begins to occur, leading to a variety of health problems, including digestion problems, skin disorders, defective bone growth, or dementia. So whilst a person is neglecting a nutritional diet, they are developing a dependency on drugs that can be either physical, psychological, or both. People who develop a dependence also increase in tolerance. Tolerance meaning they need to take larger amounts of the drug to get the same effect a person once had when they first began using the drug, whereby people who are psychologically dependent on drugs may find they feel an urge to use them when they are in specific surroundings or large gatherings, whilst physical dependence occurs when a person's body adapts to the drug and gets used to functioning so long as the drug is present in the body. People who are dependent on drugs find that using the drugs become far more important than other activities in their life and begin to replace essential nutrients of the body in replacement for some drugs I'm about to mention. Be highly aware that drugs affect everyone differently based on the following. The effects of a drug in your body will be different to another, but there is no safe level of drug use. Use of any drug always carries some risk. It's important to be careful when taking any type of drug. So the first drug we are going to be discussing is opioids. Opioids are any drug that acts on opioid receptors which are found in the brain. Opioids bind receptors which depress the central nervous system to slow down messages between the brain and the rest of the body. This causes breathing and heart rate to slow down. Opioid receptors also stimulate the release of dopamine, which is the neurotransmitter that leads to sensations of pleasure and pain relief. These are the most commonly used opioids. However, opioids actually do more than stimulate the pleasure center of the brain. You see, in the prefrontal cortex and the central reward pathway, there is a natural link between pleasure and complex thoughts, such as decision making and planning. However, neuroscientists say long-term opioid abuse makes this pathway dysregulated, meaning one person who abuses opioids in the long term will have less control over their emotions. Then you have the amygdala and the midbrain. This is where the urge to keep using opioids is born. The midbrain helps steer behavior based on what it has experienced. Then you have the locus coeruleus and the brainstem. I'm not sure if I pronounced that name correctly. But this is where the opioids suppress the brainstem's ability to control breathing and heart rate. During overdose, this can be life-threatening. But here are the most common effects of opioids. Generally, opioids include certain type of painkillers known as opioid pain medication, and some illegal drugs like heroin. Some opioids that are plant-based come from the opium poppy, opiates, whilst others are synthetic. Common types of opioid-based medications include codeine, oxycodone, buprenorphine, methadone. They act in the same way as the other opioids like heroin, illegal ones like heroin, to produce feelings of pain relief. Although these medications can be prescribed by doctors, many people don't realize that the pain relief medications can cause dependence on the drug. They should not be combined with other drugs like alcohol, which may cause other life-threatening issues. If a large dose is consumed, someone may develop the following. Long-term effects include things like this. The effects of opioids with other drugs, including illegal and over-the-counter prescribed medications, can be unpredictable and dangerous. For example, opioids or alcohol and cannabis could slow down breathing and brain activity, whereas opioids plus ice or ecstasy can cause enormous strain on the heart and kidneys and increased risk of overdose. Combining drugs is often by people with a high tolerance of drug abuse. In particular, when someone is not feeling the same effect one person had when they previously used the drug, it's due to their body adapting to the drugs being in the system of the person. The consequence is that this user is highly dependent on these substances for pain relief and psychological pleasure. Resisting the drugs becomes a difficult task. The next drug that we are going to be discussing is depressants. Depressant substances reduce arousal and stimulation. They do not specifically make a person feel depressed. They affect the central nervous system, slowing down the messages between the brain and the body. They slow down concentration and coordination, and a person's ability to respond to unexpected situations. Generally speaking, depressants can be swallowed, drunk as a beverage, injected, snorted, or inhaled. These are the commonly used depressants. Some of these depressants, like GHB, can have some physically challenging withdrawal effects for long-term usage because the body has to get used to functioning without it. Usually starts about 12 hours after the last dose and can continue up to 15 days. The chemical composition of GHB is highly variable. It's very easy to take too much GHB for a particular user. The difference between the amount needed to get high and the amount that causes an overdose can be very hard to judge, according to some reports. Use of any drug always carries some risk. The effects of depressants vary according to the type and specific chemical. Some depressants may work instantly, with effects lasting only a short time, such as inhalants, whilst other depressants may take longer for the effects to start, and the duration may last longer. Again, the effects are based on a person's anatomy. In general, when small doses of depressants are taken, the following effects may be experienced. Higher doses can result in these type of effects. Again, a combination of depressants with other drugs, like opioids, will cause more and further negative experiences, both in the long-term and short-term usage. People who use these drugs can regularly develop a dependence and tolerance to them, as with any other drug that we are going to discuss in this video, such as stimulants. Now, stimulants enhance the activity of the central and peripheral nervous system. These are drugs that accelerate the heart and elevate blood pressure while speeding up and overstimulating the body. These are the most commonly used stimulants. The effects of these drugs vary based on dependence, tolerance, and the amount. Small doses may cause the following, whereas large doses may cause these type of effects. High doses and frequent heavy use of stimulants such as cocaine can also cause something called cocaine psychosis, characterized by paranoid delusions, hallucinations, and out-of-character aggressive behavior. These symptoms usually disappear a few days after the person stops using cocaine. However, giving up cocaine after using it for a long time is extremely challenging because the body has to get used to functioning without it, as prior to that the body was highly dependent on the drug. Withdrawal symptoms usually start around 1 or 2 days after last use and can last for approximately 10 weeks. And according to some reports, day 4 and day 7 will probably be the worst experience. Withdrawal usually happens in 3 phases. The first phase is known as crash, where the user experiences agitation, depression or anxiety, intense hunger, cocaine cravings, restless sleep, extreme tiredness, and these are usually experienced within the first few days. The second phase is the withdrawal experience, where the user will experience cocaine cravings, a lack of energy, anxiety, angry outburst, and an inability to feel pleasure, and this can last up to 10 weeks. The third and final phase is known as extinction. This is when intermittent cravings for cocaine becomes ongoing. Dependence on stimulants can be psychological, physical, or both. People who are dependent on stimulants feel an urge to use them when the body adapts to these stimulants and gets used to functioning with it with the stimulant present, as like many other drugs. For example, drugs like empathogens. Empathogens cause the release of dopamine and serotonin in the brain. Serotonin controls mood, appetite, and sleep, and can make you feel relaxed. Using this type of drug can cause the serotonin levels in the brain to become very low and can also lead to hypothermia. This is when the body's temperature becomes abnormally high, caused by a failure of the heat regulating mechanisms of the body to deal with the heat coming from the empathogens. These are the most commonly used empathogens. The effects of these drugs may cause the following: serotonin syndrome, overheating, energy risk of dehydration, overhydration, erectile dysfunction, overdose, feeling a sense of belonging, understanding, or connection. Empathogens become even more dangerous, in particular with high levels of serotonin, which can lead to serotonin toxicity or serotonin syndrome. This is a serious condition which leads to symptoms such as confusion, agitation, sweating, an increased heart rate, muscle spasms, and it can be quite fatal. Regular use of empathogens can decrease the potency of the drug on your body, which may lead the body wanting to consume larger amounts, which means the body is releasing and depleting serotonin before it had a chance to build back up naturally. Experiencing low serotonin levels may lead to depression and other depressive symptoms. And as well with many other drugs, a combination of these drugs with other drugs, like we've talked about in the past, can be causing other negative experiences. For example, drugs like dissociatives, which means detached from reality. These aesthetics are a class of psychedelic drug. This class of drug is characterized by distorted sensory perceptions and feelings of disconnection from the environment and oneself. These are the most commonly used dissociatives: ketamine, methoxetamine, nitrous oxide. Dissociatives are usually ingested via snorting. It can be oral, it can be intramuscular injection, or inhaled. The effects of these drugs may cause the following. Drugs like dissociatives can cause amnesia, memory loss, and analgesia, which is a pain relief. Low doses produce stimulant effects. Medium to high doses produce a possible out-of-body or near-death experience, a very negative one that most people should be aware of. Dissociatives have general depressant effects including drowsiness, slow inactive breathing, pain relief, anesthesia, and loss of muscle control. Some dissociatives affect dopamine release and the opioid system of the body and may produce euphoria, which is a state of intense happiness and self-confidence. Large regular doses of ketamine have been found to cause ketamine bladder syndrome, a painful condition that requires ongoing treatment. Symptoms include difficulty holding urine and incontinence, which can cause ulceration in the bladder. Moving on, this next drug is called cannabinoids. The word cannabinoid refers to every chemical substance. Cannabinoids produce their effects by interacting with specific receptors located within different parts of the central nervous system. Cannabinoids regulate how cells communicate, how they send, receive, or process messages. These are the most commonly used cannabinoids. Every human possesses an advanced psychological system, known as the endocannabinoid system. These are molecules produced in the body which act as a network of receptors and neurotransmitters that help control some of the body's most vital functions related to memory, appetite, mood, pain sensation, and the immune system. Endocannabinoids are also called endogenous cannabinoids. They're similar to cannabinoids, however the difference is these are the naturally produced by your body. It functions to keep internal functions running smoothly. The body only produces them as needed, ensuring stability of your internal environment, which can also be known as homeostasis. The most well-known cannabinoid receptor is called CB1 and CB2. These are proteins that are embedded in the membrane of cells. CB1 receptors are primarily found in the brain and the central nervous system, and to a lesser extent in other tissues, whereby CB2 receptors are mostly found in the peripheral organs, especially cells associated with the immune system. CB2 receptors are also found in the brain. They're not expressed quite as densely Similar to opioids, cannabinoids produce their effects by interacting with specific receptors located with different parts of the central nervous system. Illicit and synthetic cannabinoids are usually smoked, vaporized, or eaten. As far as external cannabinoids, foreign substances, the two main cannabinoids are THC and CBD. THC is the chemical that is responsible for the psychoactive effects of cannabis. The main difference between the two is that cannabinoids have strong psychoactive effects, making a person high due to the THC, whereas CBD is thought to have an anti-psychoactive effect that controls or moderates the high caused by the THC. CBD is also thought to reduce other negative effects people experience from THC, such as anxiety, restless sleep, and nightmares. However, the effects of mixing cannabis with other drugs, including alcohol, at the same time can increase the unpleasant effects, including nausea, vomiting, and feeling of panic, anxiety, and paranoia. Some people use cannabinoids to calm down from stimulants such as amphetamines and ecstasy. The combination of cannabis and ecstasy has been linked to reduced motivation, impaired memory, and mental health problems in the long-term and short-term cycle. Researchers have found that a cannabinoid plant produces between 80 to 100 cannabinoids, as well as 300 non-cannabinoid chemicals. So the key point to take away is that our body already produces something similar to cannabinoids, known as endocannabinoids, which is ensuring the stability of our internal environment, known as homeostasis, and the foreign substance in this case is basically the cannabis, the medicinal cannabis, the synthetic cannabis, the butane hash oil, the CBD and THC. Now, last but not least important, psychedelics are also known as hallucinogens and are a class of psychoactive substances that produce changes in perception, mood, and cognitive processes. Psychedelics affect all these senses, which alters a person's thinking, sense of time, and emotions. They can also cause a person to hallucinate, seeing or hearing a non-existent. These are the most commonly used psychedelics. I don't know how to pronounce any of them apart from the abbreviated terms. However, psychedelics have been used since ancient times by various cultures through the world for their mystical and spiritual associations and religious practices. These are the most reported effects of psychedelics. Sometimes a person could experience something known as a bad trip, which is a frightening and disturbing hallucination. It's reported that this experience can lead to panic and unpredictable behavior, like running across a road or attempting suicide. Usually when a person intakes a large amount or has a strong bath, you are likely to experience negative effects of these psychedelics and potentially a bad trip. Sometimes a person with long-term effects will experience something known as flashback. Flashbacks are a re-experience of the drug and can occur days, weeks, or months, and even years. Usually flashbacks are triggered using other drugs or by stress, fatigue, or physical exercise. The experience can range from being pleasant to causing strong feelings of anxiety. They are visual and last only a minute or two. And that is the end of this video. Be sure to share this video with anyone you feel could benefit from this video's information. I know there wasn't enough time to elaborate on all of these substances, and there's definitely a lot more information and study to be done within all of these substances. Don't forget, I'm not a doctor or a specialist in drugs. However, I'm just a student sharing common knowledge, and my study is as good as your study. Comment down below if you would like to see further videos on these topics or other information. References for the information of this video can be found in the description of the video.